Psychiatry is a medical field that focuses on diagnosing, treating, and preventing mental disorders. It has a long history that has been influenced by cultural, scientific, and societal developments. Over time, the way we understand and treat mental illness has changed significantly. In ancient civilizations, mental illness was often believed to be caused by supernatural forces and was treated with spells, incantations, and exorcisms. The philosopher Hippocrates, however, believed that mental disorders had natural causes and proposed using diet, exercise, and relaxation as treatment. This approach, known as the Hippocratic model, laid the foundation for modern psychiatry. In the Middle Ages, mental illness was again believed to be caused by demonic forces and was treated with harsh methods such as confinement and torture. This approach was developed further by Roman physician Galen and was the dominant view for centuries. During the Middle Ages, mental illness was once again viewed as being caused by supernatural forces, and treatments such as bloodletting, flagellation, and purgatives were commonly used. By the 18th century, scientists began to reject supernatural explanations for mental illness, and theories about its nature and causes began to emerge. This laid the groundwork for the development of modern psychiatry in the 19th and 20th centuries. The field of psychiatry, which is based on the scientific study of mental illness, emerged in the 19th century. At this time, more humane approaches to treating mental illness, such as psychoanalysis developed by Sigmund Freud and other psychotherapies, became more common. The early 19th century also saw the establishment of the first psychiatric hospitals and the beginning of scientific research into mental illness. Later, in the late 19th century, the German psychiatrist Emil Kraepelin classified mental disorders, which influenced Freud's psychoanalytic theory. Freud believed that mental illness was caused by unconscious conflicts and developed a talking cure method of psychotherapy called psychoanalysis, which involved helping patients understand their unconscious thoughts and feelings. The French physician Philippe Pinel argued for more humane treatment of patients with mental disorders, advocating for kindness and respect rather than chains and physical punishment. In the 20th century, significant advances were made in the field of psychiatry, including the development of psychoanalysis by Sigmund Freud and the use of medications to treat mental disorders. The psychiatric profession also became more regulated, with the establishment of professional organizations and licensing requirements for practitioners. Today, treatment options for mental illness have expanded to include a range of therapies, such as cognitive behavioral therapy and dialectical behavior therapy, in addition to medications. However, the history of psychiatry has not been without controversy. Psychoanalysis, developed by Freud, has been criticized for being unscientific and lacking empirical support. It has also been controversial for its focus on the unconscious mind and its belief that unconscious conflicts and desires shape an individual's thoughts and behaviors. Some have also criticized psychoanalysis for being overly deterministic, suggesting that an individual's personality and behaviors are largely determined by their past experiences and unconscious desires. The history of psychology, the scientific study of the mind and behavior, has also been marked by controversy. Some of the early studies in psychology were conducted using unethical research methods, such as the use of prisoners or other vulnerable populations as subjects without their informed consent. The eugenics movement, which argued for the superiority of certain racial and ethnic groups, was also a controversial aspect of the history of psychology. Many early theories in psychology were also influenced by cultural and societal biases, leading to flawed and biased theories that had negative consequences for marginalized groups. Some psychological treatments, such as lobotomy and electroconvulsive therapy, have also been proven to be ineffective or harmful. Michel Foucault, a French philosopher and historian, was critical of the way psychology has been used to understand and control human behavior. He argued that psychology is not an objective science, but rather a tool of power that has been used to classify and categorize people based on their behavior and characteristics. Foucault also criticized the way psychology has been used to diagnose and treat mental illness, arguing that it reinforces the idea that mental illness is a personal flaw rather than a social problem. Other notable thinkers such as Noam Chomsky and Thomas Szasz have also been critical of the way psychology has been used in the U.S. to classify and categorize people. For example, Chomsky has argued that the way psychology has been used in schools to assess and categorize students has resulted in a significant amount of racial and ethnic bias in standardized tests and the subsequent public school curriculum. Szasz has argued that the way psychology has been used in the criminal justice system to define crimes and deviance has resulted in the criminalization of people based on their behavior. Another famous critic of psychology is Robert B. Talbert, who argues that the way psychology has been used to promote the idea that people are fundamentally self-centered and selfish is not only unhelpful but also inaccurate and potentially harmful. Talbert has also criticized the way psychology has been used in the workplace to label employees as dysfunctional or to provide a diagnosis for a problem that does not exist. Talbert also argues that the way psychology has been used to categorize people into normal and abnormal has resulted in the creation of a social hierarchy and the fragmentation of society. Another criticism of psychology that has been made is that it is sometimes used to justify discrimination and racism. In particular, the American Psychological Association, APA, has been criticized for allowing psychologists to remain silent on the issue of racism and the mistreatment of people of color in the United States. And in the book, The Triumph of the Therapeutic, the author Philip Reif has argued that psychology has been used to rationalize and justify the status quo. Reif argues that by shifting the focus in psychology from understanding human behavior to understanding and treating mental illness, psychologists have been complicit in reinforcing the idea that social problems are caused by individual flaws rather than systemic and structural issues. As a result, psychology has been used to maintain existing social norms rather than challenge them. By framing behavioral problems as individual flaws rather than as systemic issues, psychologists have enabled people to overlook the underlying causes of social problems and instead focus on treating the symptoms of these problems. This shift in focus has resulted in psychology being used as a tool of control and domination rather than as a tool of liberation. Psychology has also been used to de-emphasize the importance of traditional values, such as the belief in God, and to replace these values with the idea that a person is primarily motivated by their own individual needs and desires. Reif also argues that psychology has been used to reduce people to mere objects, with the goal of understanding and manipulating their behavior rather than understanding their inner life and emotions. Additionally, Reif has argued that psychology has been used to undermine our sense of autonomy and self-determination by encouraging us to rely on psychological experts for advice and guidance. Ultimately, Reif believes that psychology has been used to erode our sense of individuality and autonomy, and by so doing, has undermined our ability to think for ourselves. Overall, the history of psychiatry and psychology is a complex and fascinating one, filled with a range of approaches and theories about the nature of mental illness and the human mind. While these fields have made significant contributions to our understanding of the human mind and behavior, they have also faced a number of controversies and criticisms related to ethical issues, cultural biases, and the effectiveness of certain treatments. As our understanding of the human mind and behavior continues to evolve, it is important to critically examine the ways in which these fields have developed and the potential biases and limitations that may exist.